You're probably here because you saw the very alarming title. Yes, that's true. California is ranked #1 for the highest rates of cancer in 2024. Can you believe that? So according to the American Cancer Society, California is #1, Florida is ranked #2, Texas is ranked #3, and then following Texas is New York. And for that reason, I want you and I to explore different Eastern medical practices since I'm very familiar with the Western practices. My name is Cassie and I've been a registered nurse for about 12 years. I've worked in the hospital and I recently graduated as a nurse practitioner in the past 6 months, and I'm ready to explore the Eastern medicine with you. I've studied Western medicine for many years, and I'm here today to share my knowledge with you, as well as take you on a journey with me to study the Eastern medicine from the most recent and up-to-date evidence-based research. So if you're curious like I am, if we're #1 with the highest cancer rates, who are the other states that are actually in the lowest? So the 3 states with the lowest cancer rates is Alaska, the District of Columbia, and Wyoming. Can you guess the number of cancer cases in California in 2024? It's an alarming 193,000 cases. Just in 2024. The cancers that are most prevalent, ranked from most to least, is breast cancer, prostate cancer, lung cancer, and colon cancer. If you're from California, you must know somebody who has cancer, like I do. And that must be the case because we're in the state with the highest rates of cancer. Within my immediate family, I have a total of 2 relatives who have had cancer. And if I can count, I've had numerous friends of friends that have family members who also have cancer. Being diagnosed with cancer is scary and tormenting. The thought of your body just going kaput, then the cancer potentially killing you. Oh my gosh. I mean, I haven't even thought of what it was going to be like when I die one day. I mean, I've thought about it. I've had thoughts about me closing my eyes one day and not waking up and not knowing what I'm going to be seeing. Is it just a dark hole, or is it somewhere blissful? Is it like they explain it where you see a light and then you see relatives and you're just drawn to the light and then you end up in an everlasting bliss? Is it? Also, to think and to have the thought of going through chemotherapy and radiation, then experiencing all of the signs and symptoms of those types of treatments. Like, for example, chemotherapy, you get a lot of nausea, a lot of vomiting, you get body pains, you feel very weak. Radiation, when that radiation hits your skin, it burns the area. It makes it very sensitive. It's not a pleasant feeling. Not only is it physically harmful, but it's actually mentally draining. I mean, you think that you're about to die soon. You don't know if what the doctor is treating you with is going to work. You may just be that one statistic that's not going to make it, or you may be the one that will. And on top of that, all of the debilitating physical changes you have to go through, you start to lose your hair, your face starts to swell. Sometimes your teeth will become yellow from the chemotherapy and all of the treatments. I mean, this whole ordeal with cancer and fighting cancer is just so scary. And shout out to all my cancer survivors out there. You guys rock. You guys go through so much to stay alive for yourself, for your family. So after all of this depressing news, I'm really motivated to find an alternative therapy. So if you will join me on my quest of learning about the wonderful cordyceps mushroom. So this is actually a very fascinating mushroom. This mushroom is, you would say, a parasite. What is a parasite? A parasite is a thing that ravages or takes nutrients from another thing to survive. So in other words, it's using the nutrients from a living thing to grow up. It's sucking the blood out of you like a vampire. Originally, cordyceps was found in China. The original cordyceps is Cordyceps sinensis. I'm not sure if that I'm saying it right. But this mushroom was found in China in a caterpillar. What the mushroom does is the spores actually go into the caterpillar, and in the caterpillar, it begins to replicate by using the caterpillar's food and nutrients that are inside of the caterpillar. Eventually, the caterpillar dies, and boom, out sprouts a mushroom. Wow. Another popular mushroom is Cordyceps militaris. This mushroom is popular in the United States. I personally have a bottle of the Cordyceps militaris myself. And this parasite or fungus actually comes from moths. So it uses the nutrients from moths to grow. Wow, it's so fascinating. One is caterpillars, the other one is moths. I mean, I wonder what else it takes hold of and it grows. So the Chinese and Tibet cultures have been using it for many of years. They've been using it for renal disease, lack of energy, loss of sexuality, cough, and fatigue. It's been over 300 years. The original C. sinuses, the one that grows in caterpillars, is actually very expensive. If you purchase it, you can pay several thousands of dollars for it when it's collected from nature. And because of that, many different versions of it have been produced, like the ones that I take, which is the Cordycep Militaris, which is approximately like $30 a bottle for 60 capsules. And you're instructed to take about 2 capsules every morning if need be. Luckily, research has shown that the mushrooms that are grown in the lab and the mushrooms that are grown in nature, they work similarly. They're both just as effective. The one benefit that I want to focus on today is cordyceps' effect on cancer cells. Since I brought up this whole topic about 2024 and California being the highest ranked in cancer rates, I really wanted to do some research on what is there in our current science and medical research to fight the cancer. They found that this fungus or this parasite is actually very toxic to cancer cells and it doesn't harm healthy cells. One study showed that the cordyceps sinuses, the original one that came from China, they studied its effect on cancer cells and they found that this fungus or parasite helps to block the blood flow to cancer cells so that they cannot replicate, meaning they don't get food to make more cancer cells. And then it allows the body to respond better to chemotherapy. And on top of that, the mushroom, it helps your natural defense, your body's natural immunity, increase in its capabilities of helping you fight the cancer and to help you fight chemotherapy if you're getting any, because chemotherapy makes you weak and chemotherapy can affect your natural immunity. That's why people who get chemo, they're usually instructed to stay away from sick people, stay away from live animals and live product, because we all carry viruses and bacteria and their immune system is very weak. They cannot be exposed to live bacteria or viruses because they can get sick really easily. So this mushroom is proven to help the body fight viruses, to help the body fight bacteria, to help the body fight the chemotherapy that they're getting. Wow, isn't that amazing? And on top of that, let's just say your body does get infected with a virus or a bacteria, and a chemotherapy patient or a patient facing cancer, they end up having to fight off the bacteria. And then just as a byproduct, just by fighting off the bacteria in your body, it makes what you call reactive oxygen species. What is this? This is like, for example, a fire. If there is a fire in a home, the fire is fighting the furniture is burning, and that process alone is going through a war in itself. But what's the byproduct of that? A lot of smoke, right? If there's a lot of smoke in the environment, that is also very, very harmful. When you've taken these fire safety courses as healthcare providers, we're told that the number one thing that kills people is the smoke inhalation. You don't see the fire, but the smoke probably some ways away. And if it hits you and you get trapped with it, you can get suffocated with the black smoke and end up passing out. The byproduct of your body fighting off anything that's a foreign invader is still damaging to the body. That smoke in the fire, maybe the mushroom is like a vacuum. It's sucking up all the smoke so that you, when you're in the home that's getting burned down, you're not being affected by the smoke. That's kind of my analogy for it. Back to my original point. I wanted to focus on the cancers that are high in prevalency in the United States. So again, it's breast cancer, it's colon cancer, it's prostate cancer, and it's lung cancer. I wanted to see if this mushroom has been studied to help treat these cancers. And voila, guess what? The good news is that they've been doing a lot of clinical research for these cancers. Now, when I read these research articles, it's pretty complicated. There's different variations of each cancer. So one lung cancer can be caused from 5, 6, 7, 8, 9, 10, however many different types of cells. So you have a cancer growing in your lung and there's just multiple ways of growing in your lungs. So I couldn't pinpoint exactly which cancer these mushrooms treat, but it seems as though it's effective for some of the variations. Down in the link below, I've attached all of the research articles that prove that this cordyceps mushroom is effective for lung cancer, colon cancer, prostate cancer, and breast cancer. For example, for the article with colon cancer, they tested this on mice. They injected mice with a specific form of colon cancer. They let that cancer replicate some time, and then over time, they gave cordyceps to the mice for approximately 3 weeks. And then the result of it was that the cancer cell was not multiplying like it would be in somebody who wasn't treated with the mushroom. And then they tested the mushroom on breast cancer cells, a version of it. They saw that the mushroom slices and dices areas of the genetic makeup or the instructions that tell the cancer to replicate. It slices and dices the instructions so that the cancer cells can't make cancer cells anymore, as well as telling that thing that actually tells the cancers to replicate, it tells that thing that to stop making it. So altogether, it seems like it just stops the production of cancer cells, and then it forces the cells to just die. Well, all in all, if you ask me, how much should a person take if they have this cancer or that cancer, or how much should a person take on a daily basis just to prevent themselves from getting cancer? You know, there's no guidelines right now in California or all through the states. However, a lot of scientists and medical professionals are testing out the effectiveness of this mushroom or parasite. And eventually, I think it's going to head in that direction where our medical staff and our organizations are going to implement the use of this fungus into hospitals and cancer centers. Well, that's what I'm hoping for. It's really at your discretion how much you want to take on a daily. The bottle that I have, it's 1 gram. And I take that 1 gram, which is 2 capsules, take it every once in a while. I don't know if it's affecting me or how it's affecting me, but with all this research, I'm convinced it's doing something. Please discuss this option with your primary care provider, or if you have cancer and are going through chemotherapy, please discuss it with your cancer doctor, because I'm only here to support you on this medical research that I found very, very fascinating. I'm not your medical provider, so I can't give you specific advisement. I can only share knowledge with you with what I know. Thank you again for listening to my lecture and following me on this journey of exploring Eastern medicine. I hope you enjoyed my lecture today. Please subscribe to my channel if you like my content, because I would love you and I to explore this journey again together. Thank you very much. Bye.